So we're sorry for the late start, y'all. Like you say, the devil don't want this message to get out there. But good day, good evening. Welcome to the Teddy and Monica show. Once again, y'all, we're back. We had a great holiday. It was amazing. Thanksgiving. Monica, did you enjoy Thanksgiving?
I did enjoy Thanksgiving. I think this is the best Thanksgiving we've had.
Okay, one of the best anyway.
Yes.
So we had an amazing time. Family came in and it was just a great time, y'all. And like I said, y'all, I was able to rest, you all, after what happened to me. So before I introduce my guest tonight, y'all, I want to give a quick little testimony why tonight is a special night. I am a recovering heart attack patient, you all. I had a heart attack about 2 weeks ago on a Wednesday. And God allowed me to live through this thing, you all. I'm going to talk a little bit more about it, but I brought some special guests in today, and I brought them in because they are in the medical field. This is what they do. They know what they're talking about. They were with me when I was going through this situation. They came to the hospital. They came afterwards to sit with me, talk with me, give me a lot of good information. And now, you all, I really want to put this information out there so people can understand that the signs, first of all, if you're having any heart attack symptoms, anything that may cause you, because I'm gonna tell you all what I did the first part of my day. But let me introduce my guest today. You all, I have I call them Mom and Pop Bell. They're gonna give you their full names and they're gonna give you their resume real quick. So the Bells, why don't you all talk to the people tonight? Introduce yourself and tell them what you all do. Yes.
Well, first, my name is Brett Bell. My wife is here with me, Jackie Bell. And we're both nurses, registered nurses. Most of my career has been in either the emergency room or the ICU, and it's both critical care units. And so everything that I've learned, also I did some time with the cardiac step-down units.
Okay.
So it depends on, I've worked in several hospitals, Vanderbilt, St. Thomas, and Bay Medical down in Panama City.
Okay, Pops. I didn't know you worked at all those hospitals. So you were at Vanderbilt as well?
Yeah.
Okay.
Matter of fact, when I got up here, that's where I started.
Okay.
Yeah.
Okay. And then we have your beautiful wife, Mom Bell. You want to introduce yourself to the people as well?
As my husband said, I'm Jackie Bell, and I took the opposite end of the medical field. I take care of the residents, our patients, when they come for rehab. So if there's anything needed so that they can transition back into the community, then I fill in that gap there.
Okay, so have you dealt with a lot of heart patients as well that went through a lot of situations similar to mine?
Not similar to yours. As I said before, you're a miracle because
Wow.
You skipped me altogether and you went back into the community. Mine is where when they are not able to go back and function on their own in the community, and we have to build up their stamina and their abilities, that there may be some kind of physical loss or maybe even some kind of mental loss, that we step in the gap there and try to bridge that to transition them back into the community.
Amazing. Like I say, I'm excited that you all came tonight to talk with us. Y'all, I want to give my story real quick.
Yes.
What actually happened to me?
Hear your story.
What actually happened, y'all? I was at my job. I was curling some hair, doing what I do. Okay, and throughout the whole day, I had symptoms. My chest felt like I had a pain from the middle of my chest to the back of my back. And in that situation, me being a man, Pops, I don't know if you like this, but me being a man, I was saying to myself, okay, it's just gas. Mm-hmm. So I started trying to burp up, belch, drunk a little water and let out a little gas, and the pain went away. I continued my day working, talking with my customers and everything, and I went into my second customer, and it actually came back again, the same pain. And I'm sitting there saying to myself, that's when I started saying, God, I know you're not finna take me up out of here. Are you about to take me away from here? And I was saying it to God in my head voice. That's what I was saying. I wasn't saying it out loud, but I was like, God, why is my heart hurting like this right now? Once again, me being a man, I said, okay, it's just gas. It just, I might can get rid of it, and it's gonna go away. So I started burping again, let out a little gas, and said to myself, okay, it's just gas. About 3 o'clock, 4 o'clock that day, it came back again. This particular time, it came back the pain was it's so intense, you all, to where I said to my customer, let me go to the restroom. I have to use the restroom real quick because I don't want to look weak in front of her. And I'm saying it this way, you all, because men, I want you all to hear this out there today. If you feel anything that you're going through that's not normal, don't take it lightly. Don't think that it's nothing. Don't. So I said to my customer, hey, let me go to the restroom real quick. So I went to the restroom and I sit down, thinking it was gas again. I tried to let out a little gas, tried to use the bathroom, y'all, and all of a sudden, my body got so hot. I started sweating to the point to where I had to take my shirt off. I went down, I fell to the floor on my knees, and I could just crawl at that particular point. When that happened, I opened the door with shirt off and everything, and I said to my customer, her name is Nikki. I said, Nikki, call 911 immediately. When I told her to call 911, one of my other stylists, she was out there, and they were waiting for the ambulance to get there. And she came in, the other stylist named Tanisha, she came in, and she saw me on the ground. So I'm on the ground, you all, looking up, and she was asking me questions like, do I feel pains in my arm? Do I feel any pains in certain parts of my body? And the only pain I felt was in the chest to the back. That's where it was located. Normally I hear it's in your arm, but yeah, Pops, I'm gonna let you talk about that. I see you throwing that arm up. I'm gonna let you talk about that in 1 second. But when, like I said, you all laid there, and then they called the ambulance. The ambulance got there, you all, and they actually was able to get me up on my feet in order for me to get out to the stretcher. Okay, I don't know what that was about, but I got on the stretcher. And from then on, all I can remember seeing is lights going from that point to the next point, which was Southern Hills. Monica, do you want to talk a little bit about what happened right then?
I can. So Nikki called me, and of course I had already started dinner. It was in the oven. I was upstairs feeding our beloved bearded dragon, and I wasn't going to answer the phone. I saw a 901 number, and I was like, that might be Theo, so let me answer the phone, see who this is. And so the young lady at the end said, is this Monica? And I was like, yes. She said, something's happened to Teddy. We had to call 911. So immediately I thought it was his sugar. And so I kind of panicked for a moment. I passed by something and I broke a glass, and I was like, oh, I get that later. Then I ran down the steps and I started having a panic attack. And I was like, wait a minute. Get yourself together. You can't, because I was like, no, get yourself together. So by the time I had my house shoes on, I was like, turn the oven off. I thought quick, turn the oven off, get in your car, call his mom. And so I think the young lady called me back and said he was going to Southern Hills. At that point, I didn't even care. I put my emergency lights on. It seemed like everybody was driving slow that day. But long story short, I beat the ambulance there. And once I got to Southern Hills, the lady, she was like, well, he's not here. I was like, well, he's supposed to be, and I need y'all to find my husband. And so she, I don't know, I told my church family this story. I told the lady, I said, you need to find my husband. I got to find him. And so next thing I know, I see a young lady with her lunch bag. And I was like, no, this heifer didn't go to lunch, and she supposed to be helping find my husband. So I went back up to the front, and the lady I was like, look, my husband is supposed to be here. I don't know what's going on. And she was very nice. She said, let me go check. And so next thing I know, they was like, Miss Susan, come on back. And so when I entered the room, Theodore was in so much pain. The chest pains that came back. He was back and forth. And then I remember him having to throw up. And it was something, oh my goodness.
Yeah.
I had never seen anything about it like that. The next I know, all the little gadgets in the room start going off. I was like, oh Lord, what's going on? So the lady took me out. She was like, ma'am, we're going to have to transport him to Stonecrest. The cardiologist team is ready and waiting. Everything is set to go. He's got to go. And so they end up taking him out. And she explained to me, she's like, ma'am, you cannot follow the ambulance. She was like, if you do, you got to stop at the red lights. You have to, you can't just be on the ambulance tail and fly like that. So, long story short, I did make it there.
Yeah, you made it there.
I beat them there again.
To the next hospital. But I want you to pause right there, Monica,
Okay.
because I don't want to go too far for Pops and Mom. Can you actually tell me what actually happened in the knowledge that you have as in your field? What tell me actually what happened at that particular point?
Okay. All right.
Okay.
This is my picture. Mm-hmm. This is the heart. The big red thing there is the aorta, and the coronary artery. That's the artery that feeds the heart. That blood comes right off of the aorta there, and it goes right to the heart. And right here, it's right here to here. It's called the left main. I think that's left. Yeah, left main. Okay, that artery then feeds everything else down here on this side here. As you can see, that's a large area. You have a right main over here that comes around, but it only goes to a certain area. It feeds a certain area. The left main feeds the bulk of the size of the heart there. So what you were having, because how you described it, the left main, that's why your pain was not just in the front, but in the back also. Also, you should have had pain in your left arm, but thank God you didn't.
Yeah.
Yeah, because that's what most people complain of, the left arm, and they some people grab their chest, some people grab their arm. The one thing I want to point out that is an unusual symptom is for women, mainly women, and it's a pain in their back and on their right side, and it feels like it's gallbladder pain. Ladies who've ever had their gallbladder removed because it was hurting, yeah, it's a similar pain as that, and so. Some doctors just think, oh, it's just gallbladder. We'll get you in, we'll take some tests, we'll draw some labs, and we'll see. And they're actually having a heart attack.
Wow.
Yeah, so the situation is that some doctors are, let's face it, some doctors are better than others. So yeah. But anyway, if you're not sure, and the one thing you need to do is advocate for yourself and speak up and just tell people, I don't know if I'm having a heart attack. You guys are the experts, but I need you to check. If you got to do lab work, fine, do it. I need you to check and make sure.
Yeah.
And my other little thing, according to your story, they left your work and they went down Nolensville to Southern Hills. Okay, they could have gone the other direction, and they could have gone to either Vanderbilt, St. Thomas, or Centennial in about the same amount of time. And all three of those hospitals could do anything that was necessary for you.
Wow.
If you needed open heart surgery, all three of those hospitals could have done it. If you just needed to put a stent in, or angioplasty, which is the balloon blowing up and spreading out and making the opening, they could do that there. Whatever you needed, they could have done. Southern Hills, on the other hand, had to transfer you out again. And in hospital lingo, a stent is a simple procedure.
Once you know that that's what you need.
Yeah, once you know that's what you need. But Southern Hills couldn't even tell you that.
Wow.
They knew they couldn't handle it. That's all they knew.
Wow. So, in other words, that it could have got uglier.
It could have gotten
could
uglier.
have.
Yes.
So, Pop Bell, who makes the decision on where you go? That's my next question.
Well, that's complicated. Okay, the ambulance, when they come in, was it the fire department?
No, it was an ambulance.
So it was just a regular ambulance.
Yeah.
The fire department didn't show up.
No, I didn't see
So
it.
it's a good chance that there weren't any paramedics on board. If there were paramedics on board, you probably would have gone to one of those 3 hospitals. But they were just ambulance EMTs, EMT 1s and 2s, and they took you to the closest hospital. And in most cases, that's fine. They may not have. You say they walked you out to the stretcher?
They got me up off the ground and walked
You out to the stretcher?
To the stretcher, yeah.
Yeah. See, a paramedic would never have done that. 'Cause the first thing you told them, I'm having severe chest pains. Yeah, they'd have hooked you up to monitors, and they would have put you on a stretcher, and they'd have been running.
And you forgot to tell them how you know this about the paramedic.
Because I used to be a paramedic, and when I was in the military, for 22 years, and I was EMT, EMT2, paramedic. I worked in emergency rooms, and I worked independent, where I was it. I'm the only one on the site with a couple hundred people, and the only medical help they had was me and my partner.
Okay. So good. I want to ask this question right here. What's more signs that you think that we should pay attention to? Because, like I said, I thought it was gas.
Okay. If things happen the way you said they did,
Yes.
then most people would come to that conclusion. Because I know I burped a few times trying to take care of some aches, and things were fine.
Yeah.
I may have been having some changes there myself. So now that I think back about it, I was like, okay, maybe I should have gone and got it checked out. But glory to God, here I am.
Yes.
But most people, when they're having that heart attack, that pain, that when you fit that last time you went in the bathroom there, yeah, that sweating, that cold sweat, and then getting lightheaded, and the pain just kind of radiating everywhere, and you don't know what to do. It's just, you can't grab a hold of anything, and you can't squeeze it, or it's just there, and there's nothing you can do about it. And so, yeah.
Yeah, I've heard it explained as though you feel like you have an elephant on your chest.
Yeah, you have an elephant standing on your chest. Not very many people that I've actually taken care of and talked to use that description. They just said it was an awful pain.
Awful pain.
Yeah, and I guess if you can imagine an elephant standing on your chest, that maybe it does feel that way. But I don't know if I'd use that term, but that's beside the point. When you go through it, you go through it.
Yeah.
So really quick, so I know a lot of people say if they are having a heart attack, sometimes they'll say, well, won't you take an aspirin? In his situation, no aspirin would have worked during that particular time, correct?
Not really.
Okay.
No. If you had, so if you were already diagnosed with cardiac problems, you would have had either nitro. You know what nitro is?
They gave me some of that.
Tiny little white pills.
They gave me that when I got to the hospital.
Yeah, it's nitroglycerin, and it's the same nitroglycerin that goes boom, but it's much smaller quantity. And what it does,
Medicinal.
it's medicinal, yeah. And you take it and you put one tablet under your tongue,
yeah.
And in 5 minutes or so, you should feel some type of relief. If after the third one you still haven't gotten relief, they say either go to the hospital or call 911 to take you to the hospital.
Now, I did get a little relief after the second one. It gave me some relief.
Okay.
So, with being 99% blockage, though, I'm still trying to, in my mind, understand. You know, I see you got me another chart you about to pull out. You got me another chart you about to pull
here's
out.
one.
Yeah.
This isn't 99. This is more like, 75. This one on the
Okay.
the right here. I
Yes,
think that's
yes.
the right. And this right here is balloon angioplasty, and they go in and they blow that up, and it opens up the vein. I'm sorry, the artery, and this is before they do it. And so that yellow area there, that's called plaque.
That's a lot.
There's various things that can cause plaque.
Give me those various things, Papa. Give me. Come on with that.
A couple of those things, eating the wrong things, fatty foods, smoking, drinking, and sedentary life, lack of exercise. Now, it doesn't necessarily have to be fatty foods. You can overeat vegetables,
Wow.
okay? Because if you stop and think about your body is probably the
Wow.
greatest computerized machine ever created. Props to God. And so when you don't eat enough, your body decides, we got to do something to make sure the brain still gets fed and the rest of the body still gets taken care of. So it digests for now and then stores for later. And if you're one of those people who eats late at night or doesn't eat breakfast, lunch, and dinner, or eats a little bit for breakfast, kind of eats lunch, or just waits till they get to dinner, and then they pile it on for dinner, and then go to bed. Well, during that long stretch of no food, the body says, we're in starvation, survival mode. And the body does what it needs to do.
We got to stop right there, Pop. Because that's actually what I was doing. I was doing the intermittent fasting in the morning, and I was not eating until about 11:30, 12 o'clock. And at 11:30, 12 o'clock, all I was eating was fruits, vegetables, and nuts. And that was very sparing. I would eat some just enough to say I got something in my body. And I was doing that though because I'm a diabetic, and I was trying to make sure I kept my sugar low and trying to make sure I take care of myself being a diabetic. So I was absolutely wrong. It sounds to me like it was absolutely.
You were absolutely right. You're just doing it the wrong way.
Okay.
Okay.
Yeah, you had to flip that around. Okay. Any dietitian will tell you that a good breakfast, and I mean a good breakfast, you can eat those fruits, vegetables, fruits and nuts, whatever, for breakfast.
Yes.
Another fruit or something light like fish or even chicken for lunch, and then a light meal for dinner.
Salad
Salad or something like that. About 6, no later than 6.
Yeah.
They'll tell you if you're trying to lose weight, that's the schedule you want to keep. If you're curious about the best way to go, look up bariatric diet.
Say that again, Pops. What is it?
Bariatric diet.
Okay.
And you've heard of it. You may not remember it, but you've heard of it. The people who've gotten their stomach stapled, trying to lose weight,
Yeah.
they had to cut down what they eat. And they tell you this is like a saucer about that big around.
Yes.
And they put that much food on the plate, and that's it. Certain meats and other things, you had to cut them out your diet because it'd be just too much for that stapled stomach.
Yeah.
Okay, so it's called a bariatric diet, and that's how you lose the weight. It forces you to not eat so much, and once they take those staples out, people think, oh, I'm fine. I can go back to doing what I did, and they go back to putting the weight back on because they didn't learn anything the first time.
So you said something. I didn't mean to jump in on you, but you said something. The body needs that morning nutrition to actually function properly, but still the right things. We're still saying the right thing, but we need to make sure that we're eating properly, not fasting in the morning time, because
fasting is not the best. If you're going to fast, you need to fast. Okay, if you're going to follow what Jesus did, from what we know, because they didn't really tell us what Jesus did. It just said that he fasted. But since none of us were living back in that day, we don't know
Yes,
what
sir.
kind of fast he did.
Yes, sir. Yes,
Okay.
sir.
John the Baptist, he ate honey, raw honey. He ate locusts. And anybody who's ever been to survival training, whether it be Army or Air Force or Marine Corps, they'll tell you they're some of the most nutritious meals on the planet. Yes, eating locusts and things of that nature, grasshoppers, because they're almost all protein.
Wow.
And so that kind of diet, if you can stand it, would be really good. But you can just eat vegetables. You can take a hamburger, half a hamburger, no bread, cut it up with some vegetables, some fruits, a pear, or banana, or peaches, something like that. No syrup. And you got a meal.
Yes. But I want to make sure I understand. Do this in the morning, and then
morning time is important because your body has to go through the whole day.
Okay.
And so if you don't do it regularly, again, your body, it goes into survival mode.
My mama told me, boy, you gonna mess yourself up. She said that to me. She said, Teddy, you're not eating enough. And I started to lose a lot of weight doing this. I mean, you even saw that, Mom. You even said it to me when I said it.
Yeah.
So I thought I was doing the right thing. I thought I was on track. I thought I was taking some herbal supplements, and I just knew. So I wonder, could that actually attribute to what actually happened with me? Do you think so?
I don't know if it attributed to it. How long ago did you start the diet?
I've been doing it now about, it was longer, maybe 3 months, 4 months.
No.
No. Too short.
No.
Okay.
No. What you dealt with was years in the making. 20, 30.
So do you think my diabetes has something to do with it, not having them under control?
It does. Diabetes and high blood pressure.
Okay. Now I'm gonna put this out here real quick to you all. I'm on a new Dexcom monitor, and with this Dexcom monitor, Mom, I don't know if you know about this. It's something that they poke in my arm, and this thing has been helping me make sure that I keep my diabetes at a great place. Don't you enjoy it now, Mom?
Oh my goodness, it's awesome. It keeps, every time it beeps, of course, I'm yelling, what is that? What? So only thing I have a problem with is it loses its signal. But other than that, like last night, I think because we were so tired that we missed the first alarm, but the second one, it roars. And so by then it had dropped. So when it drops like that, of course, I'm scrambling, I'm jumping out of bed, and I have the juice ready, waiting. So he drank some juice, and of course, it shot it back up. But it's awesome once you know how to operate it, because I had to change it out yesterday, and that was a whole ordeal for me. I commend you all in the medical field, because just trying to put that little thing on his arm, and I know it's a little needle in there, it just freaked me out yesterday. And yeah, but it's an awesome thing to have. It helps me to know what to feed him. I think I gave him something the other day, and it spiked. So I was like, you don't get that again. So I'm just playing around with different things for him to eat and learn. This is a whole learning process. I tell people this is, he's on like 8 or 9 medications, some in the morning, some at night. Yeah, it's a wake up call for us. It's a lot of work. I know that. Just trying to balance the sugar levels, as well as, in my mind, I don't want the stent to get clogged, because his cardiologist said, the stent can get clogged. And I was like, what? Because once he put the stent in, I thought we was good to go. He was like, no, it can get clogged as well. So we really gotta watch. And so whatever he eats, we're eating in this household. So
Excellent.
So, Mom, that's something to jump in on you because you take care of patients afterwards. Do you have a regimen that you would give a patient or give someone that went through this, and something that you would tell them to actually do or eat or?
Not really, but particularly with the monitor, as you said, that's your new normal. So you learn as you go along because diabetics aren't they're not all cut from the same cloth. So your body may still be making some insulin where someone else's may not make any at all. So it varies from one person to another, and so usually we just like you're doing the trial and the error is usually what you work with, and like some people, high for them, for one person may be a normal for you. So you have to find out again. You're finding your new normal or whatever it is that works with your body. So it goes, differently. In terms of, what they usually tell you, most often the dietitian is the one who's involved with that, but you keep a record of what's going on, and so that you can see your pattern, and then when you go back to see the doctor or whomever, they'll ask you, well, how did this work and really you're giving them the information and telling them how to treat you versus them telling you what you should do, because again, everybody is individual and so it varies.
Yes.
There is one thing I want to point out, like in the middle of the night, some people, in the hospital, we have dietary assistance, 24/7. But at home, all you have is what you have.
Yes.
So there's some people who live alone. And so if you know that your blood sugar drops at night, and instead of trying to wait until you're in the middle of the crisis to get up and try to get yourself something, most people make either a half or a quarter peanut butter sandwich, or they keep a packet of peanut butter crackers next to the bed and some grape juice or something like that, something that's not going to go bad overnight, and they just keep it next to the bed, and that usually takes care of their problem. It takes them from whenever that alarm went off till they wake up in the morning.
We had that same equivalent, but we called it a diabetic snack, and so every diabetic had a snack that they were provided for that evening that they were supposed to eat before they went to sleep at night, and that usually kept them through the night. So that's a possibility. Again, since you have the Dexcom, that will give you some information as to whether or not that works for him or not. So that's something that you could try.
Yeah, that Dexcom is actually that Dexcom's 6.
They
got a Dexcom 7 out there now. That's a pretty good invention. It's saving people a lot of headaches.
It really is.
Yeah, it really is. And because, like she said, in the nursing home or in the hospital, they have that programmed out already. The dietitian has already come and said this patient needs this, A to Z, and this patient gets a half a sandwich. This patient gets a quarter sandwich. This patient, give them the whole sandwich. Because their blood sugar, when it drops, it really drops.
Yes.
And so, different people, like you said, have different situations. Some make some insulin, some make no insulin. There's diabetic. There's class 1, which is typically in childhood. They discover the child is not making insulin.
Yeah, type 1.
Type 1. And then there's type 2, which is everybody else.
Yeah, that's me.
Yeah. And so your body is probably making some insulin. For the longest time, you never had to take injections or anything like that, right?
I started after this back. This is the first time that I actually had to give myself a shot now. And, but the good part about it is we had a little mix up. I took about 15 units at one time.
Wait.
Yeah. Because we didn't know.
In pH or regular?
And pH, I believe.
All I know is I gave him too much insulin, and he dropped tremendously.
Oh yes, that's why I asked for the clarification. 15 units is that's a mega dose. you give that for somebody who's got a blood sugar of over 300 or something like that.
Well, it was close. It was about 278 to
Okay.
280, and that's why I thought I needed it. So she gave me that, and that bad boy dropped down to about 42.
Okay, was it the insulin? Was it clear?
Yes.
Okay, that's fine. It wasn't NPH. NPH is cloudy.
Yeah.
It's naturally cloudy. So whenever they tell you shake it up and look at it, make sure what it looks like. Your NPH should always be cloudy, and your other irregular should be clear. It should never have any cloudiness in it. If it does,
Toss it.
Okay. That's another good point to give out here. So, like I say, when that sugar dropped, y'all, that was the first time I had mine actually dropped that low ever.
how'd it feel?
Almost like I felt with having a heart attack, just not the pain.
Ready to pass out.
Not the pain.
I was about to pass out too, because once again, my church gave him this basket full of candy, and so he had a Butterfinger, a Twix, a Kit Kat, some Reese's. I just panicked. I was like, "We gotta get the sugar up." I didn't know I could give him some saltine crackers. I didn't have any juice here because I took everything out the house because I was like his sugar. So we had nothing here.
Yeah, peanut butter is best because peanut butter has enough sugar, fat, protein in it that it takes the body time to break it down.
Okay.
And so,
And it will start with the sugar first.
yes, sugars are always
Yeah,
first.
right.
So it breaks it down over time. So that's why I say a half a sandwich in the middle of the night or at night before you go into bed.
Yeah.
That's more than enough to keep you through the night.
Keep me through the night. That's amazing information. Amazing.
So, Pop, can you elaborate on, because, I didn't know, and when the doctor said, 99% blockage, me being me, I'm knowing 99 is close to 100, so that's bad.
Yeah.
But I learned from you all this called the Widowmaker, and I was like, what? So, can you just expound on that? Because a lot of people just think, oh, he had a heart attack, that's it.
Well, the Widowmaker. Well, it's called that because a lot of people die from the left main being blocked. Even if it's just 99% or 95%. If you throw a clot in the middle of that, in the middle of what's going on, that blocks that artery completely. And the heart dies. The heart muscle starts to die.
Wow.
And so if that heart muscle dies, if they can't get you another heart or put you on a heart-lung machine, you're done.
That right there alone lets me know that God is on. he is all over me, in me, and worship is, y'all. I got to throw this out to y'all. I truly believe that the way I worship God is the reason why He saved me, because He knew I wasn't done down here yet. Because I thought about, the whole time I was going through it, I was like, did I do something wrong, God? I was asking so many questions, like, why now, God? Is it my time? I just did not understand. But listen to everything that you just said. I know I wasn't doing right with my diabetes, and that's one thing I want to put out there, you all. I was not checking my diabetes like I should. Okay.
At all.
I can sit here and say this today on this podcast, this broadcast. I was not checking my blood sugar properly. I would check it
Every blue moon, tell the truth.
every blue moon. She's right, absolutely right. So it's a couple of things that I sit back, but I was working out, I was eating right, I was doing, but that doesn't matter, does it, Pop? That don't matter at all, does it?
No.
That blood sugar could be the thing that did it, or it could be hereditary, because my pop had a stent put in his heart.
It's probably
about
hereditary.
2.5 years ago.
That's what I was
That's
gonna
probably
ask.
because they ask you, do you have any type of history
family
in your
history.
family of these things? And if you do, then that's a box you check for hereditary problems. And so you find out everything you can about the individual's family so that you can be on the alert for these other things that may come down the pipe.
Okay, so to everyone out there, y'all, if you have any members in your family, if you know anyone that's in your family that had a heart attack, your grandmother, your uncles, your aunts, that's the same thing with diabetes. And I say this to so many of our black men. I say this to our black women as well, but a lot of black women, they understand their body and they try to take care of it. But the new millennials, the younger people, y'all, this is for you all. This is for the African American brothers, the Latino brothers, all my brothers, my Caucasian brothers. If you have a history in your family of anything like diabetes, heart trouble,
high blood pressure,
I'm urging you all to please
Kidney disease.
kidney disease.
Oh, wow.
High
Yes.
cholesterol.
All
of
that
those.
plays a part.
All of that.
Y'all, it's so many things, and y'all, this thing, it scared me. And I remember when I found out that I was a diabetic, you all, it scared me at that particular time, and I did right. I did the best thing I could do. I was checking every day, and they was cooking the right thing. Y'all were doing what we need to do, but you fall off. You
get complacent.
You get complacent.
Yeah, I got this.
Yeah.
Yeah, that's the 99% what people say. We got this.
And that's how you fall off. Because
I can miss one day. I can miss this. I can miss that.
so
Take it for granted.
Yeah, I got to the point to where I took it for granted for some years when I was doing it in fear at first. And that's the thing that I'm praying that people hear this. Don't just do things for fear.
No, because when the fear is gone, then you're going to stop doing what you're supposed to do.
You're gonna stop doing what you're supposed to do, Mama. Say, come move up to a little bit to the mic, baby, and say that. Say that in terms.
Yeah.
Say that for me one more time.
When the fear is gone, then you'll stop doing what you're supposed to do. So we just need to do what's right because it's right.
Bible has a verse
Yes.
on that one.
Can you give it to me, Father?
Oh, don't do right because the master's standing over your shoulder watching you.
Wow.
Yeah.
Wow.
The supervisor is standing over your shoulder, so you're doing everything exactly like you're supposed to do it. And then when he walks away, you just lay back and relax.
Break time.
Break time. Yeah, you might get a part on there, you might not, and about 15 of those things go down the road, and you pray to God you don't get one of them because they're not gonna last.
Yes. And look, the pastor hit on that. He hit on it Sunday, y'all. He used the illustration of a spare tire, and he said the only time you need a spare tire is when you're in trouble. You got a flat. The spare tire is there, but you don't look for it. You don't go get it. You don't use it.
You don't check it.
But you don't check it. You don't see it. Because what if you go to get your spare tire and it's on a flat?
It's dry rotted in our case.
Oh, my goodness.
Yeah.
Or it's dry rotted because you didn't go check on the spare tire.
Now
But
that's extreme. Dry rot. That's
Yeah.
extreme.
Yes.
It could be flat. That's a possibility, but I have yet to see any of my spare tires flat or dry rot for that matter.
Yeah.
Let's see. We keep our cars a long time, about 10 years or so, and so I have never had a spare tire
Yeah.
that was that flat. I've had some. I've had to put some air in them, but they got me to a gas station or someplace so I can get some air in them. But yeah, I've never seen one that's that bad.
But what he was saying, though, he was saying that that's the only time we call on God is when we need.
Oh, we treat him like a spare tire.
We treat him like
That's
a
not
spare
good.
tire.
That's not good.
And,
Not good.
And we do that, you all, with our bodies, with our minds. What did he say in the word? He said, your body, you need to treat it as it's a living sacrifice unto him. You're supposed to
The
treat
temple. The temple.
It's a temple.
it. Yes.
Know
yes,
ye
yes.
not that your body is the temple
The temple
of the Holy Spirit. The Spirit
yes.
of God lives in you.
So you
Yes.
don't treat it just any old kind of way.
Yeah.
Yeah.
If you really want an understanding of that, let's go back and read the Old Testament and how God told them to treat the temple.
Yeah. Yes.
And you understand, you got to do everything exactly right. Back in that day, you had to do it exactly right, or
right.
somebody was going to die.
They was gonna touch it and die, Papa. I know what you're going with that. Yes, sir. And that's the thing that we have to understand, because we are now the temples that he dwells in.
Wow.
And that's the thing that we have to understand now, y'all. It's no more temples that you. I love my church. I love my church. I love my church family, but that's a place that we come together to worship him in unity. But our bodies, our mind, our soul, y'all, this thing has made me really, and I'm not gonna do it for fear no more, Mama. I'm
Excellent.
totally convinced now. I've been down this road 20 years ago when I first found out the diabetic situation. I was there, but it was only because, like I said, because of fear. Now it's y'all. It's the temple. It's where God dwells now. And these past 2 weeks, Monica, I appreciate you allowing me to rest and get myself together, because I'm about to go back to work. My doctor released me to go back to work, and I'm about to get back out there in the workforce and start over again. And that's what it feels like. It feels like a do-over again for me. And I'm going to take it.
A God of another chance.
Of another chance, man. A God of another chance.
So you've been walking and getting some exercise?
We walked Saturday, and I've been down here working out and doing my thing, and we're going to try to walk at least 3 to 4 times a week. I'm not going to be slaving, and y'all, please live life. I understand that you have to work. I understand that you have to do things, but live life. I'm gonna live life now. I'm gonna do the things that I'm supposed to do. I'm gonna provide as I know God is gonna allow me, but I'm about to live life because I see it. And tell me, Mom, I mean, I know you can give me some wisdom on this. Why afterwards do you see life different after you go through a traumatic situation like this?
Wow. Unfortunately, God puts you on your back, and you have no choice but to look up.
Wow.
Yeah, you have to look up. You're not looking around. You're not running
that
here.
simple, yeah.
You're just still, and it's you and it's God.
Wow.
Yeah, so you are looking up to Him because He's the only one that can do anything about it. The doctor can do what he does, but until God does what He does, then somebody just rolled the dice.
It's amazing that you said that. My little beeper went off.
Sugar low.
You better know. But Pops, we got about 4 minutes. I want y'all to give us a conclusion on what we talked about tonight. And
wow. I want to say something about praying for healing.
yes, I love that. I love it.
Because so many people pray for healing, and they don't believe that God is a healer. We all say it. There's all kind of songs about it, but some people pray. The majority of people pray for healing for this one or that one, and don't get the prayer answered in the way that they would like it to be. And so, the first thing is, what everybody says. It's the mantra. It's that God will do what He will do. Okay, it's not in your hands; it's in His hands. Okay. So while that is true, Jesus said while He was on the cross, it's finished.
Yes.
Did He say that?
He said.
He said it's finished. And what was finished? The work that He came to do. Well, guess what Isaiah? That by His stripes we are what?
Healed. Yes, sir.
Healed by His stripes. So on His road to the cross, He took healing to the cross. He said, and He told the lady, healing is the children's bread. We're His children. So healing is already done. You're asking God to do something that He's already done. How can He do it?
I have a little twist on that, or an addition.
Hold on just a second.
Okay, go ahead.
So when you pray, don't wait till you're in it to start praying for it.
Yes.
Start praying for it before you're in it. Okay? If Granny is got a history of heart disease, then you bind heart disease in your body now. Don't wait till you're at Granny's age to start praying, oh Lord, help me, help me, help me. Yes. Start now and start doing those things that you know you need to do. You need to exercise. You need to watch what you eat and do all those things.
Yes. Come on.
Okay, what I was going to say is that the Western world, that we have a deficient knowledge of how the Judeo-Christian religion works, which is what we are. We can't separate ourselves from it because Jesus was a Jew. Yeah. They had an understanding that healing belonged to them. So they live their lives, and that's why they are all coming out to Jesus to be healed for those things that they couldn't get any relief from.
Yeah.
So we don't know that. We know about the salvation part and the going to the heaven and stuff, which was new to them, but we came in on the tail end, but we missed the first part of it. So we walk around just, oh, well, heaven is mine and I'll be healed when I go to heaven. But in the meantime, you're going through, whereas they knew that healing, as he said, is the children's bread, and they expect it here and they expect it now.
That's good.
So, so don't put it off for the sweet by and by. Put a demand on God now. What's too hard for God?
Yes.
Absolutely nothing. Now, he's not going to change your mind. He's not going to change what you do. That's the part that you have
That's our
to
work.
do.
That's
our work,
Yeah,
the
that's
here and the now.
Yeah, yeah.
Wow.
Monica, you got anything you gonna say? You can take us home now, baby.
No, I'm just saying, I'm just glad God allowed you to be here. I'm so grateful. I'm so thankful. I'm thankful for the Bells, because you all have been here several times to give us, educate us, to help us. So once again, we have to thank you. Thank you. Thank you.
Y'all, you have been listening to the Teddy and Monica Show once again, WFTB 104.1 FM, Tab Nashville Gospel Radio. And we just want to say we love you all. Y'all be blessed out there. Have an amazing week. We have another holiday coming up, y'all. Y'all be safe out there. We want to say we love you all.
And we will not be on tomorrow. We will resume next Monday.
Yes. So y'all have a blessed evening. We thank you. I told y'all it was going to be a good conversation, sacrificial conversations. Did you subscribe yet? Hit that like button. You might get something that's going to help your life. Y'all be blessed.